Hi, I'm Dr. Amrita Chakravarti, and I'm working as a consultant hematologist at Fortis Hospital, Shalimar Bagh, New Delhi. So today I will speak about leukemia and the importance of bone marrow donation and bone marrow transplant. So what is leukemia? Leukemia is a type of blood cancer. So blood is essentially made up of blood cells like platelets, red blood cells, and white blood cells. Production of these blood cells occur in our stem cells, which is a spongy tissue, and this spongy tissue is called the bone marrow. So most often, leukemia is a cancer of the white blood cells. There are several types of leukemias, which are divided mainly based on whether leukemia is acute, fast growing, or chronic, which is slow growing. So leukemia can occur in both adults and children. So what are the symptoms of leukemia? Leukemia can be hard to spot because the signs and symptoms are common to other unrelated illnesses. The most common symptoms of leukemia can be fatigue, shortness of breath, fever or night sweats, bruising or bleeding, bone or joint pains, and repeated infections. So, how is leukemia treated? Treatment depends on the age, general health, and type of leukemia. Patients can receive a combination of treatments that would include chemotherapy, targeted therapy, radiation therapy, and bone marrow transplant. What is bone marrow transplant? A bone marrow transplant is a process to replace the unhealthy bone marrow with healthy stem cells. So, unlike what people generally think, bone marrow transplant is not a surgical procedure and the patient doesn't have to go under the knife or the anesthesia. So, who needs a bone marrow transplant? Stem cells derived from the blood or marrow can be used to treat blood cancers as well as other genetic diseases, such as thalassemia and sickle cell anemia among others. So, who can donate? Most of the transplants in India use a family donor as stem cell source. However, a fully matched family donor is available in only 25% cases. The majority of patients have to depend on unrelated bone marrow stem cell donors. There is a way you can become a life savior and a superhero for a patient with leukemia. At any given point of time, there are about 3,000 patients searching for a donor for a bone marrow transplant around the world. You can enroll as a donor on the blood stem cells donor registry and become a superhero by saving someone's life. So, any person aged between 18 to 50 years and who is not suffering from diseases such as HIV, cancer, or bleeding disorders can easily become a bone marrow stem cell donor if they choose to.